Hi there, my name is Shenna Dethi. I'm here at the Digital Health Summit Studio live at CES. I'm here with Bill Evans, and Bill is with Bridge Design. You're a Zymedica company, and you're the SVP of Innovation. So you were just on a panel talking about the connectivity, right, and its disconnect. So why don't you tell me a little bit about the subject matter and what your panel was about?
Well, today I was talking about the challenges of building out new digital healthcare ecosystems and how it's now the bringing together of devices and digital technologies in the service, particularly around, say, treating patients with chronic disease or treating things like how to better recover from orthopedic joint replacement. So it's about how people should be thinking not just about the device anymore, they should be thinking about how they can surround that device with complementary apps, complementary wearables perhaps, that overall improve the outcomes for the patients, maybe shorten the duration that they're suffering from an illness or a rehab, and also how to lower the healthcare costs overall for the system.
And also for preventive maintenance too?
Absolutely. It would be, for instance, I used the example of an archetypical healthcare consumer called Sue, who is a woman suffering from type 1 diabetes. And it's about how an ecosystem could surround her with new products and make it easier for her to manage her diabetes. And I looked at that to explain how there are going to be very new ways of doing that digital healthcare opens up to build a so-called ecosystem around her.
Yeah, so what are the things that you would like to see that are coming in the future that you think would help the advancement of all of this? Is there anything that...
Well, I think as an industry, when you think about regulated healthcare rather than just, say, the wellness world and general health, it's about, we're really just scratching the surface of what a wearable means. So I think as an industry, we have been implanting wearables in people for a long time. Think joint replacement, think pacemakers, that's since the 50s. And really it's about how can we create things, devices, apps, it may be even texting people, where the system complements each other and we're much better integrated in that regard. So we offer much better support to people who might be having trouble adhering or having a behavior change that's going to improve their disease. Right. So these are the things that we need to do, the opportunity of digital healthcare.
Right, and you're with a design company, so you're working on the design piece?
That's right. I myself am an industrial designer and product developer, and the company I work for generally helps everything from digital startups, stuff coming out of labs like MIT and Stanford, all the way through to Fortune 20 companies from Denmark to Cincinnati. So we work across the gamut of types of clients, both on physical products and on digital products to help them. And my particular specialism is the usability and customer appeal of those products.
Well, that's great, because you have to make these products usable, right? Otherwise, yes, they're never going to be adopted,
indeed,
correct?
Indeed, and that's often very hard when you're struggling with a busy life and trying to manage a chronic disease. It's hard to change your behaviors. We all know that.
Well, thank you, Bill Evans, for joining us here today. It was a pleasure to have you. And this is Shenna Dethi. Thank you from the Digital Health Summit Studio live at CES.